So the Georgia HIN, the way most people see it is that it's an information superhighway. It's a vehicle, a plumbing system, if you will, even, that will connect information from all different parts of the state. The benefits for the care of children in our state are incredible. The physicians are all talking about the need for them to be able to hand off patients better to each other, from primary care doctor to hospital, from primary care doctor to specialist, from either of those settings back to the primary care doctor, and for the primary care doctor to be able to keep track of everything that has happened to their patient through some level of information that we currently don't have today at all. Basically, through some level of information for them to be able to track what's gone on with their patient while they haven't been with them, for example. They also want to be able to look for gaps in care, where a system like this, through claims data and that, could actually help a doctor understand if their patient who's got asthma, for example, and now it's early winter, maybe they haven't had a flu shot, and maybe there's a way that a system like this could shoot a reminder or some type of indicator so that a physician can know that their patient is missing something. If we were connected as a state, the physicians and other providers in the state would have the ability to know, by logging in to the Georgia HIN, for example, anything that's happened to the care of one of their patients throughout the state of Georgia: an ER visit, a pharmacy encounter, an immunization encounter, a blood pressure taken in a physician's office. I'm being visionary in this, but I think that the Georgia HIN can meet those needs as it continues to evolve. We are thrilled that the state has, first of all, has listened to the doctors about the need for this type of connectivity, and that they've taken money and invested in creating this information capability or superhighway for physicians to be able to, and other providers, school nurses, public health nurses, and others, to be able to tap into this information to deliver better coordinated care, higher quality care, better handoffs of care for the children of Georgia. In 10 years, through the Georgia Health Information Network, I think that every single child in the state of Georgia, that their care can be known by people who are trying to take care of them, whether it's a school nurse, an emergency room, their primary care physician, a public health nurse, that we can all know some modicum of information. And I think in 10 years it'll be quite advanced, but that we will all know some modicum of information that will help us deliver the right care, right place, right time for every child in Georgia. The Georgia Health Information Network, in many respects, is a dream come true for those who are practicing pediatrics in the state, to be able to have a level of information available to the practitioners in the state as we care for the kids. So my thanks go to the Department of Community Health and to the governor's office, to all of those who have invested the money and the time, and who have put kids first in our state, because they're our future.